Private healthcare has become the preferred mode of treatment for several people in the country, and this is in comparison to public hospitals and clinics, which have over time become compromised when it comes to resources and quality service delivery.
So the private healthcare, patients feel like if they have paid for a service, they'll get exactly what they deserve. The waiting times are much shorter. And the quality in diagnostics is, I think, it has gone to a much higher level now.
However, even with this shift and preference for services from private healthcare, there have been complaints that the charges imposed on patients are high compared to service delivery. This, industry players peg on the high costs of running and even operating a public healthcare facility, which somehow ends up trickling into the fee the patient has to pay.
The C311, one equipment in the lab, is over 200 million. Plus any others still in the lab, you find them around 300, 400 million. We are not talking about the CT scan, which are also very expensive. And we have also to invest into whether the facility is yours or not. You have to do the petition and provide the accessory requirements.
To this end, the health service providers and policymakers are calling for government support to offload the burden currently fully borne by the private players, yet they are complementing government's effort in providing a social service.
There should be government-private partnership policy where the government injects some money in these private units and then you control the charges. Two, there is maybe possibly if government could post some of our doctors, but do they have enough to these private units? And then they second them there so they can actually charge very less. It can also work. Point number three, look at importation of equipment and other machines they use. If they could just come tax-free.
The health sector in this country is one that has over time come under the spotlight over poor service delivery. With private health centers acting as a probable substitute to this reality, this comes with the burden of high costs being charged, a factor that requires intervention, regulation, and partnerships from the government. Ingrid Nantege, NTV Business.